Hey everyone. Okay, so today I want to talk about what's referred to as the rule of three in anatomy. Okay, so this is probably something you've seen often in massage therapy classes or other classes you're taking. What this basically means is that if you feel in your own spine, you feel the bumps down the back, right? So for those who aren't as anatomically inclined with this, basically the bumps along our spine are called spinous processes. Okay, SPs for short. A process in anatomy is basically a bump or a projection off things. In anatomy, you have processes, you have spines, you have tuberosities, tubercles, basically just like a bump, and they're different sizes and shapes of bumps, named things. So these are called processes. Okay, so spinous process on our spine, it's a bump that pushes off. So we have those on most vertebraes that go down our spine. So what the rule of three is we have our cervical spine at the top and our neck up here, right? Then we have our thoracic in the middle, right down our thorax, and we have our lumbar in the low back. Our thoracic spine is where our ribs attach, right, in our thorax. And so we have 12 of those, 12 ribs, 12 thoracic vertebrae, okay? So what the rule of three is, and it's especially used for massage therapists as well as physios and other manual therapists, basically it's a way of finding the transverse process, which is the little bump that comes off the side of the spine. Okay, so if your spine's in the middle like this, you have these little bumps that come off kind of the side like that in a transverse direction. Okay, so the rule of three states that when you find a spinous process, so say you count down, you're like, okay, C, cervical 7's right here, right? And then I'm at thoracic 1 here, the first bump. Basically, the rule of three is saying is when you find the spinous process, where is the transverse process in relation to that? Okay? Because as you go down the thoracic spine, the spinous processes here, they go from, if you're looking from the side like this, they go from straight back to starting to angle down. And you can see that on a spine, okay? So, just happen to have, totally just have a spine sitting here. Okay, so here's a full spine, okay? I know this is not great camera work, but we'll figure it out here. Hopefully it helps. So you have your atlas, your axes, so C1, 2, 3, 4, 5, 6, 7. Okay, so your thoracic spine basically starts right here, this guy. So you can see these first three, or if you just look here, I'll zoom in a little bit. So we just look at this guy. Okay, so from the side, this would be like, I'm like this, right? Okay, so these are the bumps you feel in your back. So this is the spinous process. If we look and we turn it like this, now I'm looking for the back of the body, these are the transverse processes. So these here, these bumps, these are transverse processes. So as you can see again from the side, this isn't a great model, but this here, the spinous process, here's its transverse process up there. So it's trying to show, this being thoracic 1, it's trying to show that this spinous process is actually in a line or in the same height as this one. Now you can see this model's not perfect, but they should be. They should be kind of more like this. So this is in alignment with that at the same height, okay? So the rule of three separates our spinous processes of our thoracic spine into groups of three. There's 12 of them, so there's 4 groups of 3. Okay, so you start here, 2, 4, 6, 7. So you start right here on 1. So there's 1, 2, and 3 right there. And then you have 4, 5, and 6 there. And you can even see as you go down, look at how angled this one is, how far down it is. So that would be what you'd feel if you palpated the spine. If you're massaging someone, you'd feel this. But its transverse process, if you look up, is way up here, right? So spinous process to look how far away it is. So if you, say you're palpating, you're like, oh, I'm trying to find, say you're massaging along the multifidi muscle, okay? It's a deep erector muscle in the spine. And so you're massaging along the side of that, and you're like, yeah, I gotta find the transverse process, because these multifidi muscles, they attach, I think, it's like transverse process, I think it's like 6 higher, right? So you're thinking in your head where these are, and you're like, I gotta find the transverse process of, say, thoracic 6 or 7. So as you know from anatomy, or maybe you don't, but basically the spinous process, there's different landmarks where you can find those too, right? So the bottom, the inferior angle of our scapula, the very bottom of our scapula, that's at T7, thoracic 7. So say you find T7, you're like, okay, so here I am. Now where's its transverse process? So what the rule of 3 is, going back, this is what this is saying, is the first 3 thoracic vertebrae, 1, 2, 3, 4, 5, 6, 7, right here, these top 3, so T1, 2, and 3, okay? Here's C7 that doesn't move, right? Or that's the end of the cervical. So these 3 right here, the first 3, T1 and 3, are said to be the spinous process at the same height as its transverse. Same height. The next 3, 4, 5, and 6, here, there and there, these 3, again, not a great model, but these 3 are said to be, the spinous process is halfway between its own and the one below it, transverse process. So if you wanted to find, say, T4's transverse process, you'd find the bump at T4, okay? And then you'd go just lateral. So you'd go just lateral like this to the side, and then you go halfway up to find it. And you can see it's pretty accurate. So you can see that spinous process right there is kind of between these two, right? Here's T4's actual transverse process up here, right? Here's T5. So basically you go to the side and you go up half, and that would be how you'd find the transverse process of T4. So T4, 5, and 6 are halfway between, and then 7, 8, and 9, these ones, and you can see, sorry, it's turning, they're really angled down, right? They look like, 7, 8, 9 look like giraffe heads, if you can picture that. I always thought that was hilarious, right? 7, 8, 9. So these ones, 7, 8, 9, are said to be a full length below. And this is pretty accurate. You can see the tip there of 7 is at the level of the transverse process of 8. So if you wanted to find the transverse process of 7, what you would do is you'd go over, you'd move laterally into the laminar groove. You'd feel muscles here, right? Longissimus in particular, the big bulky one. And then you just go superior, a full transverse process. Then you're on that one. Okay? So 1, 2, 3, right, same level. 4, 5, 6, halfway down, so you go over and up half. And then 7, 8, 9 are a full length below. So full length, and then from there you go up a full one. And then 10, 11, 12, all these, my arm's getting tired. All these here, the 7, 8, 9s, they really start to angle, right? The spinous process are really angling down. They start to kind of almost do this and start to balance out at 10, 11, 12. Because once you get to the lumbar, they're really straight and flat, right? They just look like that. Okay, so 10, 11, 12 are slowly angling back. So 10's the same as 7, 8, 9, and then 11 is like halfway between, and then 12 is right in alignment again. Okay, so 1, 2, and 3, and 12 are all the same height. So you'd want to find like T2 spinous process or transverse process. You just find its spinous. So C7, 1, 2, and then just go lateral. There it is. Okay, 4, 5, and 6, and T11 are halfway down because the spinous process is starting to tilt, right? So now you got to go over and up a little bit to find it, to find the transverse. And then T7, 8, 9, those ones are now really angled, right? And 12. So those ones, when you find the spinous, when you're massaging someone, you find, okay, there's the spine. You want to go lateral and up a full level to find its transverse process. Okay? That's all the rule of 3 is. Sorry about the bad camera work. I know it was maybe hard to see, but hopefully that helps. And leave comments if you have questions. Rule of 3. Awesome.